Yeah, so we are live now. We should not never press stop broadcast. Sir. So I'm just minimizing it, sir.
Okay.
By mistake on Saturday on T pressed it, so that's why.
She would have got bored.
Yeah. So there will be a delay of 10 to 15 seconds, sir. Like when you speak, no, it will take some time for to stream. Sir.
Okay.
Now we are live, sir.
Declare it here.
No need to declare anything. So you can introduce and then session.
What is the course I'm learning?
Psychiatry and overview, sir. I wrote here, sir.
Okay.
Right, sir.
Hi, I'm Dr. Alok Bajpai, and I am the course instructor for this course, Psychiatry and Overview. And she is Prama, she is my TA and helping me very gracefully. So yeah, please ask me whatever questions you have. Everyone is asking.
Yeah.
Do we need to write that?
Yeah.
Yeah. You can simply
type,
ask.
type.
Kindly, please post your questions in chat box. I click here. No, it's not there. Yeah.
Achha.
In stylus, we can dash.
So you might as well start answering some of this, isn't it?
Right.
Okay.
Why it takes longer time to take OCD?
So yeah, somebody has asked a few questions on Shubhadeep Patra has asked few questions on OCD, that is obsessive compulsive disorder. So the first thing is that why it takes longer time to treat OCD, why sometimes patients need to take 10 years or lifetime medication. What is the role of medicine? Apart from SSRI drug, are there any SSRI drug? Are there any effective drugs for OCD? What are the side effects of SSRI? Is it true that sometimes a person with OCD found to be extremely talented and creative in terms of educational research? Does serotonin level help him in achieving that height? So I'll club another question with it, because that's also an OCD. Ashok is a faculty member, is asked, is consumption of alcohol, smoking, even suicidal thoughts is a form of OCD? How to overcome these thoughts? All right. Is there any other question on OCD? No. All right. Okay. Let me revise. What is OCD? OCD is, by definition, is obsessive compulsive disorder. Obsession are repetitive thoughts from your own mind, which are intrusive. They are ego dystonic. That means obviously your self-image doesn't like it. And they are not in your radar of things. So these are thoughts, and these can be of various types. They can be impulses, they can be ruminations. That means a set of thought which can keep coming again and again. Doubts. And some people also have compulsions. That means they do certain acts either to control these obsessions or to just follow these obsessions. Right? Like some people who get blasphemous thoughts, like sexual thoughts about gods or deities, and they start counting to control these thoughts. So this is a type of compulsion. Now, when you ask why it takes longer time, see, if you look at the neurophysiology, what is happening that when we do any act, for that matter, any act, like suppose I have to pick up this cup. So I picked up this cup. So the centers in the brain which have pushed me to do this act, once the act is complete, they will automatically say the task is completed.
Right.
Now this whole circuit doesn't recognize that the task is completed.
Right.
So the brain keeps firing in that loop again and again and again and again till it comes to the. So the longer the OCD, the longer it takes to treat.
Right.
But that is true with most psychiatric illnesses. If
The chronic the course,
the longer the
difficult
treatment. Because why? Very simple. If it is a problem of 1 week, 2 weeks, 3 weeks, most people, the brain would have still not got into that pattern of firing.
Right.
But as it continues for over a long time, the brain gets used to it. So for a brain just see what, if you look at it philosophically, what is obsession? Whatever you have done, the brain is not agreeing that you have done it. So it has to push again and again. So all our acts, brain has to really, brain just wants to keep things under control, under proper predictability, so that it can project and anticipate the future. It doesn't like uncertainty and ambiguity. And that is why when suddenly things happen which you're not expecting, if the things are innocuous, you start laughing. And if they are not, then you get shocked, anxiety, and the whole drama of life continues because of these shocks. So the longer it is difficult to treat. Some people, they are very effective medicines these days. The main group of SSRIs, serotonin selective reuptake inhibitors, which actually block the uptake of serotonin from in between the synapse. So what it does, when there is a less serotonin being taken up, there is a cycle sets up which regulates the receptors in the post synapse. So there is a neuron, there is another neuron. This is a post synapse, this is a pre synapse.
Right.
So what happens is that this whole loop will decrease and down regulate the receptors. When there is a lack of serotonin, the receptors upregulate, they are more. So 10 years or a lifetime, it also depends on how much cognitively the person understands OCD. And that is where cognitive behavior therapy and exposure response prevention, all that steps in.
Right.
Medicines plus certain form of therapy is the best result. Because OCD is not one illness. If it is a very early OCD, then medicines will improve, like it does in some children in childhood onset OCD. But as it becomes chronic, the person essentially, see, what is the baseline of all therapies? But no medicine will go and wash out the thoughts, because any thought can become an obsession.
Right.
Beyond a certain point of time and space, beyond its context. So you can't erase all thoughts from the head. What it does is, somebody has asked something.
There is one question.
Okay, it will just come to it.
Yes.
When I'll answer
We can complete this section.
Right. So what happens is that, so person has to not fight with the thoughts, because the more you try to fight with it, the more you try to pay attention to it, the more it increases. And any attempt to stop obsession creates anxiety. We know by definition also. So what has to one learn is to ignore the thoughts.
Right.
So take off your internal camera from these thoughts to external world.
Right.
That is where CBT and other forms of therapy steps in. So obviously the involvement of the person is very, very important. Unlike schizophrenia, where one person is psychotic, the antipsychotics have to work. Unless they work, nothing is going to happen. Sometimes we use other medicines like benzodiazepines or atypical antipsychotics like risperidone and aripiprazole to augment the effect of SSRIs. But SSRIs are the mainstay of treatment. Side effects, obviously serotonin has its own side effect in increasing anxiety, and there is a whole list of side effects which you can get in any book, and not all of them are common, but largely most of them are pretty free of side effects for most people. But you have to still choose in what age group you are giving. As far as you're talking about OCD with creativity and all, see, some people have obsessive compulsive personality, OCPD, and ancastic. They are perfectionists. The perfectionists in theater, cinema, science, they're very good people. As long as they do not go overboard. Per se, OCD has got nothing to do with creativity and all. Actually, it disrupts creativity, because creativity requires a lot of divergent thinking. OCD brings in a lot of convergent thinking. I hope I have answered your question. So, whether alcohol, smoking, suicidal thoughts are a form of OCD? Not really. There is a school of thought which says that alcohol is like OCD. Obviously, you keep on going into the same pattern again and again. But going by the strict definition of obsession, it is alcohol. Suicide can happen in depression, schizophrenia, and a lot of other things.
Right.
And they are more into a pattern of substance abuse and substance dependence. They have a different circuit altogether. Like dopamine, although serotonin drugs do improve
Alcohol consumption.
the craving. But where there is underlying depression and all. Per se, there was a debate at one point of time, but I don't think they would fall into. If you spread the definition of obsessive spectrum, then maybe you can talk about it. Right?
But not in the strict sense.
Not in the strict sense.
Okay. So we can go to answer this.
Present generation students more addicted to mobile, and what are the steps to avoid mobiles? Srinivas Reddy. Hi Srinivas. If you ask me in one simple sentence, the only way to avoid anything is not to do it. So you don't use mobile, especially with the younger kids, say in adolescent, or their minds become very addictive to it. Because mobiles, the way they have been made, addictive. So it's not needed, especially the smartphone and WhatsApp and all. I mean, at least Anuj is asking something. Are self-help books helpful in treating anxiety? It's emotional and a real concept can improve. It's a sham. Sir, some students feel very difficult to study social science standard, but they're good in maths. What advice shall I give to them? Okay, Anuj, let me try to answer you. Self-help books, to some people they help. Some people who are on the edge of confusion, who are not very clear about things, and they want true rationality is very rare. Like Freud used to say, we are not rational beings, we are rationalizing beings. So we'll do something, and that will be an emotional act, and then we'll rationalize. Very few people are able to keep their thoughts and emotions separate. But a lot of other things people want to call it emotional. I think emotional intelligence simply means balancing your thought and emotion, nothing else, in one word. Mr. Motilal is asking, difficult study. See, all kids have their different differential ability. Some are good in math, some are not good in math, some are good in language, some are good in music. This was a concept which is outdated now, but still people have the same template, and this is a differential that keeps us unique. So it's all right to be good in one or two subjects and not so good in. They don't have to excel in everything.
Right.
And there are a lot of helps available how to go about studying. People can study language subjects if they are not good at it in points. Write shorter answers, write 2-word answer, and similarly in maths. So it's a matter of exercise, nothing else.
Right. Shilu Mishra has asked, what is MMPI?
You can answer that.
It's the Minnesota Multiphasic Inventory.
Yes.
And it's a diagnostic test for personality disorders and other kind of psychiatry disorders.
Right. So we use sometimes MMPI to quantify the symptoms or behavioral expressions in various personality disorders. Sometimes it's diagnostic, as you said. Sometimes it's for research.
Yes.
Right.
Okay, so we can.
So we have more questions now. Shri Bharati has asked, is it enough to go lectures alone for exam? If you ask me, I have given the lectures, so I think they are enough. But you can read as far as you possible. Read the doc, which is what is that? Synopsis of Psychiatry.
Synopsis of Psychiatry. And you have also given the reference for OTP or
Oxford textbook of Psychiatry. So knowledge is unlimited.
And also the transcripts are now available, so you can also go through the text transcript.
Yes. Majority of disorders are explained either in ICD term or in DSM-4. How far is dependent as per DSM-5? Who is this? Nandita. She's a faculty. Hi, Nandita. See, these disorders are, you should understand that all psychiatric diagnosis is different from medical diagnosis. As I said in one of my initial lectures, medical diagnosis is based on the cause that is leading to these problems. Whereas psychiatric diagnosis is based on the behavioral pattern of what you observe, because most of the causes are not known. So going back to the causes is a second step. First is the diagnosis. So all international classification of disease or DSM-4, as is DSM-5, are based on behavioral syndromes. And then over many years, studies have been done to find out that what will be good to diagnose schizophrenia. So whether if somebody has 1 month of schizophrenia, is it schizophrenia, or initially it was 6 months, but now it is 1 month. So, but then there are questions that are never answered. Acute psychosis is a short-term psychosis. What happens to it after 30 days? It becomes a schizophrenia. So these type of debates are still going on. It's a classificatory system which gives us the diagnosis, and then we match the drugs and all that. So DSM-5 and DSM-4 are as good, but we have to follow the newer ones, because DSM-5 is a new thing which has come up. They have included more categories, created more categories. Some of the categories have been changed, and that is the ongoing collaborative understanding we are developing.
Anuj has a question.
Anuj, how to convert chronic anxiety to improve into 2? Oh man, Anuj, you know Mahatma Gandhi? He was an expert of transformation, and he was a fearful boy. He kept fighting his own sexuality and his own rage from within all his life, but he transformed. The Gandhi we know was a Gandhi of 50 years. If you can get hold of my another talk, or whenever it comes, that cognition, transformation in lives, it has Gandhi a part of it. You can only treat chronic anxiety if it is not an illness, if it is not a phobia or whatever. One, by analyzing the whole ABC of it. What triggers it? What do you do when you are anxious? What are consequences? And then learn to ignore the triggers. Make alternative goals. Make alternative of expression. Like Gandhiji made that whatever somebody says, I'll behave non-violently. So he kept doing it. And he tweaked his mind 20, and this is not one-off. Normally, all of us, including me when I'm saying it, we try to change, but we'll change for an hour, 1 or 2 days, and then get back to the same routine. That doesn't work. What works is that really go. So when Gautam Buddha sat down, I'm sure he had a lot of anxiety, because he was already 6 years and he was trying to find out, he couldn't find out anything.
Right.
So when he sat down, either he would have given up or he would be in huge anxiety at that time. So, but it's a practice which you should keep doing and keep reading about people who have done it. So as I said, Gandhi is one example, Buddha is one example. So anxiety, also some amount of anxiety is good for living actually. If there's no anxiety, you'll not push yourself.
Performance anxiety.
Performance anxiety. It's an inverted U. Little bit of anxiety improves your performance. More anxiety kills you.
Detrimental.
Yep.
Okay.
We have more questions here actually.
Yes.
Can you explain cognitive therapy in detail? I think this 1 hour live session is pretty short time, Nikita. What I would suggest is what you can do is maybe read about it from some source, and then you can ask us or some other psychologist in the discussion section.
Right.
Someone fails to acknowledge their own actions, commitments, words. Is that an abnormal too? How do you deal with someone who doesn't feel any guilt or there's anything wrong with them? Tanya, it's very difficult to say whether these people are psychiatrically ill, because you just move your head in the society, in and around, you'll find a lot of people like this. And especially in today's world, where people don't commit themselves. You see, people will say something, then there are, then they say, I'll be quoted out of context, there's that. In contrast to people in the past, when they, so that is, I don't think that is an illness, that is a cultural problem. And cultures, you know, keep going up and down. So, especially in India, when it approaches that, okay, chalta hai, nothing is happening. So, you have to have a pinch of guilt. Guilt is also a trigger for transformation. It's the biggest. So, but only if you cognitively understand it and analyze it. Otherwise, it will all go in air.
Right.
Yeah, we have next question. Yes.
Want to answer
Okay.
this?
K. Niklavos. Am I right? What is the importance of psychiatry in the manufacturing domain? Psychiatry in a manufacturing domain. You should tell us. You are an engineer. How we can use this. Although, if not exactly manufacturing, but the number of software work is being done. Like we are devising apps for cognitive behavior therapy, for self-therapy, and for understanding your illness. So those stuff, the digital world is already in. Mental health is a big thing in this 21st century.
Right. We have two questions.
Which type of neuron connects one neuron to other neurons within the same region of brain or spinal cord? See, this is Shilu. See, neurons are very, very specialized cells, right? So in between each neuron in the gray matter, in the 6 layers of cortex, is connected to the other by 2 or 3 neurons. And that is how you have 10 to the power 11 neurons, each one of them having 10 to 1000 inputs.
Right.
And so that makes it 10 to the power 14 synapses. So there are complex circuits, and they are not widespread. They're not very long circuits. The longer neurons come from brain to spinal cord. There are a lot of interneurons which connects, but neurons, after all, they are neurons. We have dendrite, cell, axon. So they are specialized. No neuron is different from the other. It will take a specialized function depending on what area it is working. Yeah.
Okay. Anxiety disorders. Srinivasa Reddy.
Are one of the most common mental health problem on college campus. Yeah, anxiety disorders are today. See, as I said, there's a bit of anxiety which is normal. So if your students don't have anxiety, they'll not study. So some anxiety is all right. And that is an age of turbulence when people are in campus. They don't know the uncertainty about future, career, relationships. Every damn thing is a confusion in life. It's more of an existential crisis. Now, sometimes it can cross a threshold. Sometimes people get into substance abuse, relationship breakups. There were less psychiatrists previously. So people used to go back to their homes and God and gurus for this. Now we have psychologists, everybody keeps jumping.
Right.
And we are trigger happy in diagnosing all this. So not everything is anxiety disorder. But yes.
Increased anxiety.
It will, because absolute numbers have increased. The 1% in 100 years back used to mean something else. 1% now means something else. You lecture on Gandhi in public domain. Where to access your seminar on Lord Krishna, which you mentioned in the back of your book. Oh, thank you, Anuj. I can send it. I'm in the process of transforming myself. Maybe I'll write something on larger thing on Krishna. But there are too many books on mythology, creating all superficial fictional stuff. So let's see if something deep can come out. But I have talk on Gita, which is a slideshow. Maybe by some means, if you can send me an email somewhere, I will send it to you.
Right.
Uh,
OCD and schizophrenia related.
we really exactly don't, Shailen, we do not know whether what genes are causing what. There are some findings here and there, but no definitive gene has been found. Schizophrenia with OCD is very common. Pure schizophrenia without depression, without is becoming rare. Illnesses also over years with medication, with the environment, with culture, they also change their shape.
Right.
Like schizophrenia was a very bad illness 100 years back. There was a downward decline all the time. Now 80% schizophrenics are able to take their medicine and work. Same is with OCD. So maybe overlapping, possibly. Everything is overlapping because of 30% genes which go in making body. 70% is like dark matter. We don't know the code. They just get uncovered. Epigenetics, environment, toxins, trauma. So trauma is not always bad. Huh? It's a great trick. Changing. If you can use it. Yes.
Right.
Swarnamina. School these days have become liberal. Teachers can't be too strict. As a result, they refuse to conform even to societal rules. School is a very, very special problem. See, the thing is that obviously what you're saying is right. You can't punish and all. So use democracy with them. If you can't hit them, give them their responsibility.
Right.
Also let consequences of their action. Only then they will learn. Unless you fall, you don't know what was right and wrong.
Right.
Sometimes you keep doing wrong things and you're not caught and you think, yeah, chalta hai. But someday you're caught, it hits you. So it's very important that you get caught. It's not that it's all, not everything is bad actually. It may be looking bad in short term, but that's how it moves. And we have a video actually, it's on YouTube. Rama and I have discussed on childhood. Type and find it out.
Right.
Probably you'll get some answer. Why is schizoid considered a disorder? How is it different from introversion? I saw a schizoid way back. I don't know whether it really exists. See, schizoid is not on the same spectrum as introversion. Introversion, extroversion are a different thing altogether. Introverts are largely, they are like extroverts, except that they don't want to express and talk too much. Right? So they are within that range of normal. Schizoid slightly falls outside. Schizoid person does not have the need to socialize or need to make friends. Right? Unlike a person who has social phobia. A social phobia may be an introvert. Introvert people have relationships. They're like other normal people. They just talk less. The problem is that
within a small group of people, they're as good as
they're normal. So they just don't want to socialize too much. Social phobia wants to socialize, but in a social situation, they start getting anxious. Schizoid does not have a need to do it. Sometimes elders hurt us with their unexpected win, which makes us angry. This is life, Kirti. All this keeps happening. Don't get too hurt and don't take too seriously. You may feel sad, bad, whatever. Minimize it. Don't get too upset with it. Take whatever is of importance and let it go. So I keep saying that we are mixing mental health of life with illness. Lot of illnesses which come to us like anxiety, like this problem, school problem, they are not problems. They are problems of living.
Right.
So what happens? But we are a generation in hurry. We want to treat everything and we want to just so that creates a lot of difference. And most people do not have the time to really differentiate. Clinical psychologists and psychiatrists.
Right.
Shilu, you can tell Brahma.
Okay, so clinical psychologists are individuals who are trained in the field of psychology, who are specialists in diagnosing psychiatric disorders and provide the treatment for it through the help of psychotherapy and counseling. On the other hand, psychiatrists are medical health professionals who have done their MBBS, following which they have done a specialization course in which is called an MD or DPM in psychiatry, and they would prescribe medicine to treat the same psychiatric problems that the clinical psychologist would be dealing through counseling and psychotherapy. So one is a medical professional and the other is a non-medical professional, in the terms that they would not be prescribing medicines.
Right. Wonderful. What else is there? Let's take a question from here.
Yes.
Who is asking? I'm where? Nicole, I'm in Kanpur, Uttar Pradesh.
Right.
And Ajay, CBT and medicines both are helpful in anxiety. And in initial case, when the symptoms are severe, only medicines help. Because CBT obviously it's about the cognitive learning of the brain, so it may take a lot of time before it responds. Maslow puts self-actualization last in hierarchy. What does actually mean to be? Oh, Lord Krishna said, Swadharmam nidhanam shreya paradharma bhayava. Apne dharma, even if you die in your dharma, is better than living in somebody else's dharma. That dharma which he meant was not Hindu-Muslim. He meant your inner nature. So after your rest of the needs are taken care of, then you can self-actualize, means you can reach to the potential with which you are born. For Gandhi, it was also said self-actualization and self-mutualization. When Gandhi was moving, he was taking the world along with him. But this is not a rule. If you go to medieval India, Bhakti period, there were poor people who were writing Ramcharitmanas and Kabir and all. So it's not necessarily that you get a good AC room and then you can self-actualize. Okay. Wait, we'll take it
from here.
Tanya will wait.
Okay.
Please share the case history which are challenging to you. Two people, Karthik and Adas. Challenging. I am the most challenging case. Yeah, but this is a longer question and I think I should not divulge because this requires a lot of confidentiality. The other question is, I would like to ask you one thing. How can we stabilize our mind while talking without being stubborn, and how we can avoid stammering? Stammering sometimes because of the anxiety. I think what one should do is, if one knows what one has to talk, one should prepare about it. While talking, you should stop looking at yourself from the eyes of others. So don't perform, just talk naturally. And you can take your time, talk slow, think and talk. So no, there is no hurry, but we tend to, the moment we try to talk too much, too fast,
right,
and try to answer even before, don't jump the gun actually. And train your mind, practice. Yeah, what is this here? Psychopath, sociopath, narcissistic type of personality disorders too. What are the criminal tendencies which psychiatric illnesses are found most frequent? Oh. All psychopathy, sociopathy, narcissism, everything is there in all human beings. Believe me. All of us have genes for schizophrenia. All of us have genes for depression. Somebody's genes get turned on, somebody's not. Right? So these type of stuff all of us have. Now, when it becomes extreme and you start becoming problematic to yourself or to society, then it becomes a problem.
Right.
So criminal tendencies, antisocial personality disorder, sometimes schizophrenia, even depressed people can do nasty things. Because it's after all, they don't know what is depression. The brain feels that it is not right. So brain goes and hits a bottle to feel happy, or gets into some physical liaison with somebody. So what is a criminal? Criminals are people who are doing things with intent. For the same act, a mentally ill person may be excused because of the lack of intention. That is where law and mental health get separated. Intent.
Right.
Vandita, when a person has too many fields of intent, it becomes tedious to choose the correct path in life. Oh, Vandita, how should I answer you? Have one path which will give you good bread and butter, and try everything else. Yeah, I do psychiatry, I do physics, I do music, I do Gandhi, I do Mahabharat, Krishna. So poetry, whatever I can get hold of. But core is psychiatry. I can leave it if somebody promises me good money. What is alter ego? You tell.
No, sir, you answer.
I don't know what is alter ego. Alter ego is somebody like your own self being exhibited by other person. When they're friends, now they will say, he's my alter ego. More or less they think alike, they're aligned on the same page and all. But it's a more literary term and some psychoanalytic term rather than. So we have a question here.
Yeah.
What are your views on
Applying.
Ghanen? Actually, there's a lot of work which is being done on machine learning, especially in my institute where I studied in NIMANS and a lot of this technological institutes in IISc. Neuroimaging, a lot of deep machine learning is being applied. And especially the network theory, the graph theory, the connectome. There is a big project which is going on in a multi-centered. NIMANS is also part of that, where they're collecting data on cohorts using the genetics, their neuropsych assessment, their
Right. So he's asking the question in relation to probably dissociative
No,
identity
no.
disorder.
No, I don't think it's related to bipolar.
Okay.
Okay. Anything else?
So someone.
I have a schizophrenia problem. Can I learn about? Yeah, why not? I mean, schizophrenia, after all, is an illness. You just treat it and move on. It's like polio or having a broken shoulder, which I have right now. And so you can just move on. I don't think that is a big problem. Knowledge is everybody's. IT में चला जाता है. Right. Anything else? Okay. Say something.
Chat is disconnected.
No internet. Where is Murli? Huh? Okay.
We'll go and find him.
Let me check.
Your net is gone.
Okay, sir. Here it's blinking only. No, you can proceed, sir. It's okay.
Yeah, nobody is asking anything.
Unable to connect to chat.
Where it's showing.
Yeah.
Yeah, but no.
Wait.
Yeah. Message is going.
Yeah.
So I'm listening from there. If anything,
Yes.
I will come again.
I think we've answered
Most of the
questions.
Yes.
Nothing else, huh?
Mhm.
Anything else? Anybody? We'll wait for a few minutes. Look at the video. Sure. Promotion.
Mine is real.
They have my email, no?
Probably.
Okay.
If you want, you can give the email ID.
Okay. I think we should wrap up now. Or wait. No.
It's almost 5.
Yes. Oh, wonderful. They don't have questions.
The internet is very slow. I guess even if people are asking, we are not getting.
Yeah. लाइट ना बढ़ा तो इंटरनेट तो चलाओ इसकी वाट लगी हुई है
I'll call Muli sir.
No,
because we want to
आ
have-
रहे आ रहे
नहीं आ रहा है.
देखो कुछ करो अगर कोई सवाल पूछ रहा हो तो पहुंच ही नहीं रहा होगा ये तो चेक कर लो न्यूज़ के लिए चल रहा होगा वीडियो के लिए नहीं चल रहा है So I think
So you want to conclude, sir?
I can conclude
Yes,
unless somebody is asking questions. Or
Right, sir. So we can stop the broadcast, sir.
You
we
can.
stop? Yeah.
you want to wait for 2 minutes because
Yeah. We'll wait for a minute and then we can close.
Right.
Internet is very slow. Yeah. I think we need to get a separate IP for live event.
Yeah.
Yeah. So till this question we answered, na, sir?
yes,
Okay, sir.
and we have put some messages here,
Right, sir.
some book and
Yeah.
all that stuff.
So later on also the students can view these things, sir.
Okay,
Mhm.
wonderful.
Okay.
And you can send me the
Video.
Right, sir. I'll send you the link,
last
sir.
time. Like,
Sure, sir. Sure, sir. I'll send you, sir. I think
Okay.
we can wind up, sir.
So thank you very much, Prama,
Thank you, sir.
for all this.
Okay.
Okay. Thanks. Thanks, Murli.
Yes, welcome, sir.